and welcome to this special edition of Women's World. Family violence remains a serious issue in Papua New Guinea, an issue that is too often behind closed doors. In this episode, we explore what the health sector is doing in response to family violence. Family support centres have been established in hospitals around the country to provide services to survivors of family and sexual violence. We start with the Family Support Centre in Tari Hospital in the Enga Province, where we speak to the manager of the Family Support Centre, Claire Lembo, as well as to the Tari Hospital CEO, Dr. Hewali, about the services they provide. We also look at how the Oil Search Foundation is supporting the work of the Family Support Centre in Tari.
Those survivors who come here who are sexually abused, we always tell them, it's not your fault. Most of them are female. We always tell them, it's not your fault. My name is Claire Lembo. I'm a nursing officer by profession. Currently, I am the unit manager for Family Support Center. I'm from Tari. In FSC, we deal with survivors of family and sexual violence cases only. We provide 5 essential services. Our number one service that we provide is medical first aid. Medical first aid, we are talking about lacerations. Those ones comes with bleeding, especially the intimate partner violence and family violence. If the injury involves like bones, tendons, nerves, then we cannot manage it here, so we refer them straight to accident and emergency. They did the surgery and provide a medical treatment in there. They are coming only here for the psychological first aid. So that is the second service that we provide. It's like a medical first aid. If I have a cut on my hand, I apply pressures to stop bleeding. So similar to that, psychological first aid is also similar to when a survivor comes in, they come with all sorts of traumatic experiences. Some cannot cope with the experience that they face. So what we do, you have to calm them down. The process, we have a format there. After going through that, and if we identify them as a red flag is that when we found out that he or she has a suicidal thought, he or she wants to chop her finger off, doesn't want to take care of herself or himself, those ones need counseling. So we have counselor here. We refer them straight to the counselor, and counselor is the one dealing with such cases. And the third service that we provide is especially for the sexual violence cases. Sexual violence cases are rape cases. Rape is a medical emergency. If they come within 72 hours, we provide them with PrEP, post-exposure prophylaxis, to prevent them from being infected with HIV/AIDS. So we give that only if the survivor comes within 72 hours. Number 4 service that we provide, we prevent them from getting hepatitis B and the tetanus. So we give them 2 injections. And the 5th one that we provide is when the woman is being forced, they might end up having an unwanted pregnancy. We've got this emergency contraceptive pill where we used to give it to the survivor. If they come within 72 to 120 hours. So those are the 5 essential services that we provide in FSC.
I think the nurses have already explained to you what kind of service that we are providing. But at the management level, this is one of the tip of an iceberg where untouched, it's a it's a very big problem where we see about 800 to 1,000 cases every year. And then that is only coming to Tari Hospital, but not including other 3 districts due to transport difficulties and law and order problems. FSC, this has been initiated by the MSF, when they were providing health service here back in from 2008-9 up till March 2016. That's the time when MSO completely withdrew the service, and then we come into partnership with all such foundations and the National Department, and then the Hela provincial government, and by way of declaring this hospital into a provincial hospital status, level 5.
I am Dorothy Tai, and I work for Oil Search Foundation in the capacity of Provincial Development Manager. My role purposely is to coordinate the activities in the Oil Search Foundation. The Family Support Center was initiated by MSF, and once MSF left, then the program dropped. So Oil Search Foundation came in to assist to ensuring that the program runs, and it's a very important program when it comes to gender. So most times this program, it works with those people who are traumatized and are victims of any forms of gender, and also intimate partner violences, as well as any forms of violence. Oil Search Foundation supported Family Support Center by assisting and looking after 10 staff, and also donated a vehicle to ensure the program goes on.
So those are the most important thing that we really needed, the vehicle, because when we went to NDOH to ask the vehicle, they said no fuel, you have to refill non-driver. So then Oil Search donated us with the vehicle, and then we went out to the various communities to do awareness on family and sexual violence cases. Those survivors who come here who are sexually abused, we always tell them, it's not your fault. We are not here to blame you. When we are talking about rape cases, it's an emergency that happens when somebody is really threatening you with bush knife, forcing you to have a sex with you. So any patients who comes here, we always give them confidentiality. Everything that we do here, we always say, we calm them down. That is not your fault. You don't have to be blamed. Everyone here, everyone comes to us, experience the same problem that you are facing. We have treatment, everything here for services that we have. We want to give it to you. So after all, you'll be okay after the treatment. Those are the messages that we normally give it to the patients. We are not here to blame them or judge them. We have to accept them like any other patients that come to us for the treatment.
Welcome back. We continue to look at the health sector response to family violence. In our last segment, we looked at the 5 essential services provided by the Family Support Center in Tari Hospital in the Enga Province. Apart from the 5 essential services, the Tari Family Support Center has an outreach team. The outreach team carries out awareness to remote villages, breaking barriers as they go.
it's my job to go out and spread the awareness to the community.
I'm still calling Wabi, part of Wabi. So this land church area. So we've never been walking out of the drive. We also
So even though they get against on me, I didn't get angry or go against them, but I tell them and educate them, doing this thing is not right. So you have to do this and something like that. My name is Godfrey, EMTV. I'm from here in Tari, and I'm 25. I am an outreach worker in Family Support Center in Tari Hospital. And I normally do awareness on the services that are available in Family Support Center. And I do awareness to all the places in Enga Province, and I encourage other young men like me, age of me, and I normally address them that family eating women and having sex with young women or committing sexual violence is not good. I also do provide some information on that, and if they are able, if they find some sort of this type of problems, I also show them referral pathways where they can seek for medication, especially for the sexual violence and family violence. They can come to FSC. Young men and the men, they also go against me, because you are talking about women and you stand for the women. So most of the times it was sometimes it was so challenging, but I normally stayed on my side, and I really talk to them where they can understand.
So much of the people in the rural areas are not aware of the services that we provide here. We get out there to talk to them of the services that we provide here, especially for the family sexual violence. So we get to many local organizations such as community. We go to schools, church groups, and our language of presentation is always our local vernacular, because we are locals, and then we are held ourselves, and we know how to use that language ourselves. Even there are some sex terms in there as well, but we try to use it in a way that people will understand those sex terms. Sometimes the men try to argue with us, saying that we've all the rights to do whatever we want to do with the women because we have paid them. It's the cultural obligation that lay on the woman. But then when we tell them that there are laws that you have to protect the woman, sometimes they agree with us. But then at the same time, we have some educated people out there at the community level, those who, some church leaders, they come in to say that sometimes they also have the rights.
Men involved in such activities, I feel that is the example to other men out there. They can talk on what we are doing to the women, it's wrong. In Hela culture, it's different from other provinces. Hela, when a man pays you with bride price, it's like man is owning you, possessing you, they can do anything they want. And it's very hard for the women. Women, they come here, they said, I have no choice. I have to go back to the abuser. She has to live with him. So when a man involved in such activities like this and giving awareness to the men like himself, some men can change. Or this one is doing like this. So example, men who doesn't hit wife. These are a good example to other people in the community.
Welcome back. There are 15 family support centres around the country. In this episode, we feature 2 of the family support centres in the country, one in the Tari Provincial Hospital and another in the Port Moresby General Hospital. In this segment, we speak to Tari Soy, who tells more about the family support centre at the Port Moresby General Hospital.
We have had children who are actually in high school who've been abused by someone they know in their home, and they don't tell their parents until very late, but it's been happening since they were small. We are seeing those cases. Please come. My name is Tari Soy. I'm actually the clinical manager for the medical social work department, but the family support center actually comes under my umbrella. I oversee the running of it and also the service that we provide. The FSC's main role here is really for us to produce medical reports. We call them survivors, we do not call them victims, because the terminology usually tends to put women down when you say you're a victim. But when you say you're a survivor, you're coming in to report that you've been raped or you've been beaten. It empowers the woman or the child or the man that they're taking a stand, they're doing something. So psychological first aid is given when a survivor comes in, just to actually calm them down, be able to for the person to actually settle down so they can be examined. Then we also do prevention of HIV, the PEP, post-exposure prophylaxis for anybody who has been raped, but they must come within 3 days. It's got to be, the medicine will only work within 72 hours. Then we have prevention of tetanus and prevention of hepatitis B, and we also do prevention of pregnancy. So those are the 5 essential services that we provide here at the Port Moresby General Hospital, FSC. We also train to what we call do in-depth counseling. So how to go about avoiding that confrontation. Like if you've been in a relationship, when your husband's been beating you for the last 20 years, it must stop, and you can make that stop. Come and speak with us. We can help you along, your journey to try and get to the other side of GBV, not having, and not worrying about what your husband is doing, but at the same time taking responsibility for yourself. And if you do that, then, I'm sure you will see greener pastures in the future. Okay, we are situated in the Port Moresby General Hospital. We are the old blood bank for people who know where we are, but there's also gate number 2, where you come through, you turn right at the canteen going up to Labour Ward. There is a placard outside the hospital with a yellow banner, and it's got hands stopping. That is our sign where we are, and we've got some posted also inside the hospital. Family Support Centre here in POMGen actually comes under the Port Moresby General Hospital. All its functions are funded by the Port Moresby General Hospital. But I'd like to give a great shout out to DFAT and AusAid for helping us and donating a bus. 15-seater bus for our survivors. We do things like transport them down to the refuge homes. We actually pick them up. We also take them out to the welfare services, the NCD, Family Sexual Violence Action Committee secretariat that started. We take them to the PNG DLA. These are the high-risk cases. These are the cases where, if they go out, their husband sees them, I'm going to beat them up again. So we've got special, needs patients, and the bus is a really good, one that we've been given.
Thank you for watching this special edition of Women's World, highlighting gender-based violence, prevention and response in Papua New Guinea. Coming up in the next special editions of Women's World are counselling and care for survivors of family and sexual violence, the legal and policy environment in PNG, men as champions of change, economic empowerment, empowering youth and adolescents, and many more. If you have a story to contribute, feel free to get in contact with us at womensworld@mtv.com.pg. You can watch this edition again online at EMTV Online, www.mtv.com.pg. There is also a radio version available for your listening on FM 100. We look forward to you joining us here on Women's World. Until next time, take care.